Hematology, oncology, pathology, thrombotic microangiopathies. All right, so for thrombotic microangiopathies, we first have to understand what's occurring at the pathophysiological level. And all that happens, the etiology of what occurs, is that we get these clumps of platelets, but they're not huge in order to cause like a blockage. They just are small little clumps that fly through the bloodstream and start to lyse red blood cells. And so those will present with the symptoms that we're going to see. So we start to use our platelets up in minimal amounts to create these small little clots that fly through the bloodstream and lyse red blood cells. Okay, so that's the first important topic that you have to understand about thrombotic microangiopathies. Now, there's two separate types that we need to compare and contrast in order to understand this fully. The first type is called thrombotic thrombocytopenic purpura, which is just TTP. Okay, so TTP, what they love to ask about this is the pathophysiology behind TTP. And what it is that we have an inhibition or deficiency of a specific protein known as ADAMTS13. Okay, and this is just due to autoimmune antibodies. And what ADAMTS13 normally does is that it degrades von Willebrand factor. So if we have a deficiency or an absence of ADAMTS13, then we have an inability to degrade von Willebrand factor multimers, leading to a large amount of von Willebrand factor. And that causes an increase in platelet adhesion and aggregation, because we know that von Willebrand factor is necessary for platelet aggregation to begin. So this is why we get microthrombi to form. And that's what causes the lysis of the red blood cells. The presentation is going to be relatively similar to HUS, which is the second form of thrombotic microangiopathy. So I'm going to start talking about the pathophysiology of hemolytic uremic syndrome, which is also known as HUS. Now, HUS is, once again, the end goal is we're going to be forming those microthrombi formation, but it's formed in a different way. It's usually caused by Shiga toxin producing E. coli, and the serotype is going to be O157H7. That's a question that they like to ask. And the typical presentation is going to be a child who has ingested undercooked beef. They love to ask questions about children that have ingested undercooked beef at a picnic the night before, the day before, or have been to, they like to say like a festival or a carnival the day before, and now is presenting with bloody diarrhea. So if you see that typical presentation, automatically put HUS, okay, H-U-S. And if it's a child, then know that it's going to be pointing you towards hemolytic uremic syndrome. However, if it's an adult elderly person, then you know that it's going to be pointing towards more TTP, thrombotic thrombocytopenic purpura. The presentation, once again, is similar for both of these because they both are thrombotic microangiopathies. So you get a triad of decreased platelets, you get decreased hemoglobin, you get schistocytes, and increased LDH, as well as increased creatinine. Now, the main difference between their presentations is that TTP has neurological symptoms and no bloody diarrhea, whereas HUS has bloody diarrhea but no neurological symptoms. So make sure you understand those differences. Very, very key to understanding thrombotic microangiopathies. The labs will show normal PT and PTT, and that's a way that you can differentiate it from DIC, disseminated intravascular coagulation, because at times it's very hard to tell what you're dealing with, whether it's thrombotic microangiopathies or DIC. But that way, if you have normal PT and PTT, you know automatically you're not dealing with DIC, you're dealing with thrombotic microangiopathies. For treatments, HUS is supportive care. So if the patient is coming in, child with bloody diarrhea, and they're asking you what you should do for the patient, there's not much that you do. Just provide them with supportive care and it will pass. The treatment for TTP isn't relatively high yield, but some say plasma exchange, but there's not much that you really need to know there. But overall, what we need to understand, and just an overview for thrombotic microangiopathies, is one, both of them cause microthrombi formation, which leads to the lysis of red blood cells. In TTP, it's mainly going to be seen in adults, elderly, and the pathophysiology is due to inhibition or deficiency of ADAMTS13 protein, which leads to a decrease in degradation of von Willebrand factor, so an overall increase in von Willebrand factor. And the symptom that you should definitely be looking out for is neurological symptoms. And then for HUS, it's mainly going to be in a child who went to a carnival the day before or ate undercooked beef the night before, and Shiga toxin producing E. coli, O157H7 is really important due to the fact that we have endothelial dysfunction. And the main symptom for HUS is bloody diarrhea. That's all for thrombotic microangiopathies.